our tone of voice as an international, so from where I'm coming from, when I am speaking very loudly, I am not being rude it's just that's the way we are. We are naturally very cultural difference. We are naturally a loud person. When I'm saying something, I'm speaking very loud. I'm not trying to overshadow what is being said or being dismissive or not. But that's just the way we talk. My voice is always loud, and I feel like, especially because I feel like there is like English is not my first language, so I need to speak it very loudly so that people can hear what I said. That's what I have teach myself in my brain. Then my voice come out very loud, and it seems like I'm being rude or I'm being just out there for
but
some
that's
people.
but like I'm not being, but for you guys coming over, like last year you came from the airport to uni. Some of you didn't even have anywhere to live.
True.
Straight into a medical practice in a country that you didn't know, a health system you didn't know, and yet still expected. Like, I walk onto the wards and I don't know what I'm doing, and I've been in the UK 30 odd years. So I think it's really important that it's acknowledged that you guys don't know, and it's like language barrier as well. Like, we were talking about how like different words are said and not understood, and like, what was it you were saying about?
I said it was a time I was telling my assessor was telling me, oneness wisdom, oneness will you be in? I said next tomorrow. He said, no, you're not coming in tomorrow. I said, no, not tomorrow, next tomorrow. So next tomorrow means 2 days after today, and tomorrow is today. They said, that's so weird. That's so. I'm like,
so for us, that's the day after tomorrow.
Day after tomorrow.
So that's the next tomorrow.
I think another thing for me is the fact that we are master's students, and maybe on the first placement, and your assessor finds out that you have 2 years, so they think that yes, we come with experience, but they expect a lot more from us, and because it's a totally different setting for us, so we may be a little slow initially, but of course as mature students we catch up very fast. But it's giving us that space to know that this is a new environment for us. Yeah, we have experience, but not in the UK. So we need to. There's some things that may look basic to you, but we don't know it because that's not how we practice back home. So because I experienced a bit of that in my first placement, so being able to give us a little time so that we can just adjust, understanding our situation. At the end of it all, for me, I see it as a win-win, because you take what you have there, take what you have here, put everything together, and you're a better person. But it's just that initial start, being able to let us just get into the system. Naturally, just transition in smoothly.
And like I said, if I was to step into a Nigerian hospital training to be a nurse, I wouldn't know the first thing of what I was doing. So for you guys, it's really different. And I think the communication is massive anyway.
Yeah, it's massive.
But for us as students, I think it might be a little bit I don't know what's the word, kind of underrated a little bit, because I think it's go and almost do some work, go and wash the patients, go and be with the patients, and then it's kind of like, well, where do we step up then into being a student nurse? It's kind of like we're happy to do the basics. We need to do the basics because that's the basis of nursing. But there's also that time where sometimes we just need to kind of go, actually, I'm here to be a student nurse. So how can you help me be a student nurse rather than just helping on the ward, kind of thing.
What I observed in the ward setting is, in the placement, if it's to be 100, 20% of that placement is the learning experience, 80% is doing basic roles, trying to build a muscle memory. If this happens, this is what I should do. If this happens, this is what I should do. If this happens, this is what I should do. So when you tend to be in that rhythm, sometimes the assessors overlook you while having a nursing opportunity for you to learn that thing. They overlook it and start doing it, but when they recall, they say, oh, I have a nursing student, come over. Give that to the next HCA, come and learn while we're doing this, we're doing it. So I think that's kind of helps. And then the communication aspect is in the sense that we pronounce words differently. So I might say a different meaning of the same word might be like, say, wired and words. I might say word, say, you mean wired. So it's the language thing.
I'll give you an example of the communication. In my first placement, my assessor said to me, I did something, and she said to me, I will do it this way. I thought she was telling me what she would do. I didn't know she meant I should do it that way, because and I learned it along the line. She said because I understood that when she wants to say or rather it's general, instead of saying do it this way, she would say I will do it. So first time she said it to me,
That's,
I was
that's,
looking.
That's the way you would do it.
didn't-
That's the way I
yeah.
want to do it.
Yeah, I didn't understand that she was trying to explain to me that
Try it.
Yeah, try
Yeah.
to do
So
it.
sometimes
Yeah.
they said,
Yeah.
I am familiar with it raining cats and dog, but due to I'll say, is that cats and dog outside raining?
No, it's not. It's not cats and dogs. It's just rain. It's just English weather.
Exactly.
Yeah.
Exactly.
Yeah.
So
Yeah. But it's the same with patients as well, because like if patients say things to us that we don't understand, or that, you know, they kind of, it's that thing of like, oh, it was a student, like, you know, it was, oh, I said it to the student. Goes back to like people using our names. Like, no, it's that kind of thing. It's like, well, no, it's, you know, you said it to Joanna, or you said it to Francis. If you
say I say it to Abiola, I'm sure my supervisor or my assessor will still know that you're referring to me, rather than say it as I did to the student.
Especially if there's 4 students on the ward, it's kind of like, well, which one? It's like we're all clubbed together under this little umbrella of like inexperienced bodies sometimes. And it's not it's not the case. It's just it's making it personal. And is it the same with mental health?
Yeah, it's the same with mental health, to be honest. Sometimes when I remember in some cases when maybe you want to have a moment or sometimes spend some time with the patients, and then you've been delegated to do it. The moment the patients realize that it's going to be done by the student, they just like sometimes draw back, and then they just don't want to do it. And in my mind, I know that I've said it to one of the patients before, that if you don't give me the opportunity to learn this, I would not learn it when I qualify. I might not be able to do it. At the end of the day, I would also be a nurse, and doing this thing with you would actually help me to help you. If you don't give me the opportunity to engage in this and use this as a learning opportunity, when I qualify and I have to do it, I might not be able to do it. So at the end of the day, yes, I'm a student, but I am a student because I want to learn, so that I would qualify and I'll be able to deliver it.
And ironically is that even though the nurses are not presently looking at you, they are observing what you're doing, so they won't let you put a patient in harm, whatever it is.
Exactly.
They won't let you do what you cannot do, what they feel that you're not capable of. And
doing.
even though they're not standing there, they're observing. They are actually there.
I have had cases actually where I'm like, maybe we're actually looking at my opal, and then I'm like, I want to start saying, okay, I've achieved this. So say, yes, I know you've achieved that. And I'm like, how? How did you know? So I've actually observed that, our assessors and supervisors always get feedback, even when they are not there.
Do you not find though as well that, like for me anyway, for somebody to come and say to you, like, I've seen you achieve this, or like in our proficiencies, to actually have a conversation about what you've achieved is so much better than just logging in and going, oh, they've signed 15 of them. Like, how has that happened? Like, for someone to come and say, like, oh, I've observed you doing this, you did it really well, you kind of think,
I will sign that off your
and you think, I'm learning, like I've learned something, I've achieved something, rather than just waiting for it to be done.
I noticed that what happened in my case was I opened my Opal, they've all been said, I'm like, what? So what trait behavior I adapted from my first placement is being proactive at all times, like trying to go to the nurse, what do you want me to do, what more can I do, without you knowing. They're observing it, they're like taking off this, taking off that, putting you in such scenarios where you can be able to achieve that without you even knowing. So we just go and do it, they just go in and tick. That's what they do.
It has its good part and it has its bad part, because then you would know that you would be on your toes at all times. However, when you have missed something, and maybe for some reason it's being misconstrued, maybe there is like a learning opportunity, maybe let's say we want to wash a patient and there is a misconstruction going on, miscommunication going on, and that's the point where your assessor was assessing you, and they see that you didn't do it well, and then they say like that's not achieved. However, it's not like that's a moment something, like
you have the time to do it again,
and again
you're on the placement, and it's something you do every day, and you have the time to build on it. Because I've had some proficiencies that I thought I've achieved, and I would speak with my assessor, I'll say, I did this, you say, yeah, Francis, I need to do it again. I need you to, she says, I saw it, but we need to do it again. So maybe she doesn't feel I'm competent in it yet, and then eventually over and over, and then she says, okay, yes, I'm okay now.
But that's the whole point of proficiencies, isn't it? And it's like it's about being proficient. It's not about, I've seen you, it's not like see one, do one, teach one. It's about being like, I'm terrified for the fact that I'm going to be responsible for people in 8 months' time. But when I'm on placement and nurses say to me, no, Joe, you can do this. Like, I trust you to do this with this patient. Like, go and do it. Like, you kind of feel like, okay, that's,
That's true.
that's a good thing.
Yeah, it is a good. Yeah.
One of the things that have really built my confidence in placement is, especially my last placement, when they realize that you're in final year, when I come in the morning, if they'll say either you take this bay, or if the section I'm in has 7 patients, Francis, these 3 are yours. So from the handover, you know what this patient needs for the day.
Yeah.
So I want
Yeah.
you to take charge. So the ones that, like, if there's IV, I'm not supposed to do it. So I know the time that the IV is supposed to be given. So I go to the nurse and say, we need to do the IV. If let's say we gave gent and we need to check the gent level, all those things, I'm supposed to know when it's supposed to happen, and I have
Look
to
at
go
you
back.
talking like a nurse.
I was about to say the first
And I have to
placement.
go and I have to go and say this is what's supposed to happen now. So it really, really helps me, because
Yeah.
I mean practice makes perfect. So
Yeah.
for me, that was a very good one for me, really.
Yeah.
Yeah. I was about saying the first placement, how we're all confused in the first 4 weeks about the abbreviations that we see on the handover.
Oh, they
sheets.
Don't get me
The
started
handover
on that.
abbreviations.
Yes,
You keep saying,
yes.
Yeah.
what
What's
is this?
going
What
on
is
here?
this?
I still have some of those issues even
do I
till
need
now.
do I need a dictionary to
Yeah.
to
You
know this?
do.
know,
Yeah,
yeah.
you do. Yeah.
But what again helped is the opportunity for you to be in health carer, like
Yeah.
being health assistants in the weekdays or any day you're free. You do it in different ward settings,
Yes,
and
it's-
you now know
it's
those
also a very
abbreviations,
good
the meaning.
opportunity,
Yeah,
yes.
that's
Yeah.
it. That
Yeah.
helps too.
The thing is, though, not everyone has that opportunity
Yeah,
to do it. Like, we've
no.
got students who have got families
True.
or who have got
True.
like visa restrictions, so they can't
Yeah.
work. So to rely on the fact that they go out and get experience in their
Yeah.
own time,
Yeah.
you know,
Yeah,
it's quite
well,
hard.
Yeah,
like,
yeah.
you know, and it's even those
Yeah.
of us who can work, it's still not easy.
It's
you
not
know,
easy,
and
yeah.
it's
Oh
it's
god,
just
I remember I really, really struggled with a lot of abbreviations when I
Yeah.
first
Yeah.
started. I'm like, what's this?
Yeah.
What's this? And then you go back and check and look at it, but it's very difficult to remember it on top of your head. It takes
Yeah.
a lot of practice, months
well,
of practice.
they've been there for years. Like, they know
Yeah.
they know it from, you know, and I think it could probably be quite annoying for the staff on the wards.
Yeah.
Yeah.
And even in community,
Yeah.
like in
Yeah.
care homes and
Mhm.
GP surgeries and everything, that we just walk in and onto their everyday work, and we're like, "What are you doing?
Yes,
Like, what is
questioning
this?"
what is this? What it is? Yeah.
And if you think of the amount of students they have, and they have to, you know, they have to say, you know, HTN stands for hypertension every time. You know, it's a bit like,
we would also be tired if
Yeah,
we were in
most
their
people.
case.
yeah.
Actually,
So
it
you know,
was-
we
yeah.
kind of have to give
But-
them a bit of credit for that
Yeah,
as well.
yeah.
But
I
yeah.
also think that one good thing that happens in placement is that everybody's like a teacher. Even the HCAs, they're very experienced.
Yeah.
HCAs are amazing.
I have asked some HCAs, why are you not a nurse? Why are you not studying nursing? Because they know it.
Yeah.
And
Yeah.
so to learn, where to learn from, you're not looking for it. Everybody will teach you. Well, actually, when you want to learn, the nurses are
Yeah,
there, the
once
HCAs.
you practice.
Yeah.
And sometimes, like, why
Yeah.
are you not a nurse? Because you know these things.
Yeah, you know
and they
these
just
things.
tell you it's with the experience. They've been here for years, and it's really a good one.
And it's actually good to see, because it's like okay, I would also I
Learn
think I
this.
would
would
get
do
there
that,
someday.
yeah.
I think I would
Yeah.
get there, and it's actually very good.
Yeah,
so.
and they're the ones as well with the tips and tricks. Like, you know, they know the equipment, they know
Look,
the
what works for the
bits and
patient,
pieces.
how you can get this done. Oh no,
And
Yeah,
really.
they do.
There's one they do. Okay, I assisted a nurse in doing the peg thing. So I don't know. There's a way they do it. If before they fix the node, before they push in the fluid, they twist it, hold it like this, so the air bubbles don't go in. It's little, but it makes a very big impact.
Yeah, massive.
Yeah.
Techniques.
Yeah, those
yeah.
little skill
all those,
techniques,
all
yeah.
those, all those, yeah,
Yeah.
all those like hits and yeah.
And you know, you tend to see the stark difference between you a newbie to a qualified. It's a long road, like, and you really have to learn
We have to
and put in the
have to
effort
step
to-
up. Yeah, we have to step
And
up.
the
learn
encouraging
all
thing
those
is that, like, whenever I ask, I'm like, maybe a medication round, the nurse knows all the medications,
Yeah,
everything.
and,
I'm
and
like,
what they do,
I'm like,
and the
how? Because they
contraindications.
keep asking me.
Yeah.
But the good thing is that the ones that we do often, you pick it up very fast.
Very
Yeah,
But
yeah.
when I keep asking, you should not worry that
And
when
you-
you start, you know, when you're in a ward, you these things, they come naturally.
Yeah, and you will be surprised how fast you can pick up on it, because I remember when I first came in, and then there is a lot of medications, and I think, okay, this. But I am surprised by the time I was leaving my placement, I was
You were
talking
there.
like a pro,
Exactly.
like, okay, this is
Exactly.
this is
One
and
of my
then-
favourite days was when a patient was on a medication that the nurse didn't know, and I was like, I'm not the only
You
one.
want-
And like they had to look it up, and I was like, oh, this is what it does. And I was like,
Yeah.
oh, thank goodness,
Yeah.
they're not
So
walking
my,
dexterous.
my last placement, there's this newly qualified. She just got her pin. The uniform was blue, blazing. So during the handover, I think this is her first time working on orthopedic ward. During the handover, after the whole thing, she came up to me. She knew I was listening. What does this abbreviation mean? Okay. Because the abbreviation, and there's one that I find it very hard to pronounce. Necrophoma. I don't. Is it? What's that?
Necrophema.
Necrophema. So I keep pronouncing
Enough.
it. Exactly. So
Yeah.
Another
Yeah.
refreshing thing for me is like in my last placement, I had up to 4 or 5 newly qualified nurses, and they all came from Bournemouth University. So I interact with them a lot, and I'm like, so in a few months I can do this. So I keep asking them, when did you start? When did you start? And I see the confidence with which they work, and I'm like, wow. So by the time I qualify in a few months, and I see the support that they were given, prior to, because most of them started about the time I was in placement or just before I joined placement, and before I left placement, I've seen them as they are moving the trolleys, they're on their own, they're working independently, and it's very refreshing for me. I saw both MSc students, both BSc, and it gives me a lot of confidence that, okay, Frances,
you can do it.
You
You can do it. You can do it. You
Yeah.
can do it.